I met a family recently whose child had cancer, and she was trying to understand palliative care, and I said, well, if you think back to when your child was diagnosed, did anyone sit with you and ask you a question like this? Tell me what your understanding is of your child's illness. And she was like, as a matter of fact, nobody did. And that kind of a beginning to a conversation makes the world of difference.
So I'd say last night he's kind of at the turning point that hopefully he's getting a little bit better.
Pediatric palliative care is care that's delivered by an interdisciplinary team, usually consisting of doctors, nurse and nurse practitioners, social workers, chaplains, with the goal of helping families realize their hopes and goals for their children, mostly caring for children with life-threatening illness and their larger families. From a medical perspective, when we're involved in the care of a child with an illness, whereas the primary healthcare team's responsibility is to figure out how to control the underlying illness, say it's cancer, or say it's heart disease, and what are the best medicines to treat the heart disease or best interventions to treat the heart disease. Our responsibility is to think about the whole patient and to understand through conversation what's bothering them the most, what's making them feel, if they're experiencing pain, what the root of the pain is, trying to assess that, and then trying to treat it. So we complement the primary team by bringing to the table a focus on symptoms as opposed to the underlying illness.
There is really nothing in the literature about the role of primary care pediatricians.
In the ideal situation, a primary care pediatrician should remain involved in the care of a child with a serious illness. The problem is, so much of the reason why children are living longer is because of the highly complex technical care that's delivered primarily in hospital settings. It's just logistically extremely difficult for the pediatrician to stay involved. So the separation is problematic, and it's part of the role of a palliative care service to bridge that separation. Our service is primarily supported through a combination of institutional support, and we're very fortunate to have support from both Dana-Farber Cancer Institute and Children's Hospital Boston, and then philanthropic support and grants, with some revenue generated through billing. But I would say, if I had to make an estimate, we probably cover about 20% of our costs through the revenue generated through billing. Our hope is that, together with families often, that these children live for as long as possible, well into adulthood. And so I think about pediatric palliative care as why not? It's all about enhancing support for families who are facing very, very difficult situations.